Good afternoon, everybody. It's Kevin Stevenson. Thanks for joining me on today's episode of I Don't Care with me, Dr. Kevin Stevenson, where we talk to people who have their hands in a lot of things healthcare. Sometimes we branch out and we'll talk about just leadership management style, but today we're focusing on an aspect of healthcare that, in our country, in my opinion, we do an abysmal job of, and that is dealing with mental health of our citizens. And so today's guest is Kacie Kelly. She is the Chief Innovation Officer for the Meadows Mental Health Policy Institute. And Kacie and I met at a function last fall, and we got to talking, and I found how interesting she was and the work that they do at Meadows. And I definitely want to have her on. So, Kacie, welcome to I Don't Care.
Well, thank you, Kevin. I'm really excited to be here and excited for our conversation today.
Well, thanks. Tell my audience a little bit about what the Meadows Mental Health Policy Institute does and what you do specifically as their Chief Innovation Officer.
Great. So the Meadows Institute is a nonpartisan nonprofit that's Texas-based, and we're still pretty
Mhm.
young. We're about 11 years young at this point, and
Okay.
we operate at the intersection of policy and practice change to accelerate higher quality mental health services. And so what that looks like on the ground is we go into health systems and help them execute state-of-art mental health care delivery. And we use that on the ground intel, if you will, to feed and fuel the policy work that we do at the state and the federal level. And while based in Texas, and born in Texas, we actually are now operating nationally and have been for a number of years. And that on the ground real world information really does help us make sure that the policy change we're asking for is actionable and solving the right problems. And in my job as the lead for innovation, I get to work with entrepreneurs and investors to help them understand why they should care about policy and how it could be impacting their bottom line, and to really start thinking about policy as a growth lever as opposed to only a compliance tool. And then I also spend a lot of time listening to entrepreneurs, especially, so that I can better understand where there are some real barriers in the way that we finance healthcare and scale healthcare innovation. So that we can try to get to work and address those problems through policy change.
Well, my first question is around how do you use policy to accelerate innovation instead of slowing it down? Because a lot of us in healthcare, we've had to deal with a lot of policy and regulations, and oftentimes they're just barriers to basically anything we want to do.
Yeah. Well, and that's exactly the point. And Kevin, you know, because you have spent a career working in healthcare and within the existing healthcare infrastructure,
Mhm.
how formidable it can be and how perhaps antiquated it might be. But a lot of entrepreneurs don't appreciate the infrastructure that exists and how or why they should be thinking about it early in their growth of their company. And so they don't design solutions that can more easily fit into our existing healthcare structure. Um, and so what happens is by the time they start thinking about policy, they're really in a position where they're needing to blow through cash, waiting to get through that political machine. And where we're coming in is we're trying to get them to start thinking about it earlier in the growth of their company so that they can make adjustments in how they're designing and thinking about their scaling strategy so that it more easily integrates and fits into the healthcare system so that they're not sitting there for 2 years waiting on that regulation to come through or waiting to figure out whether or not there's a
Mhm.
billing code for their particular solution.
Yeah. Okay. So everybody agrees that early detection in mental health is predominant. So unfortunately, when you follow the money, that's where everything gets complicated. So, how can we fund or who should pay for that early detection? And what kind of innovative funding models have you seen that might actually help align those incentives?
Yeah, so we're really bullish on early detection, and have been since
Mhm.
our birth. And part of it is because we know that on average, it's 10 years from when someone first starts experiencing mental health challenges for when they actually try to engage and get care in the system. Can you imagine
Mhm.
waiting for 10 years with cardiac problems
Yeah.
before you started to and the other issue is that when it comes to mental health, we expect the patient who's struggling to raise their hand, say, I have a problem, and then figure out how to navigate to get care. And so a lot of the work that we're doing is actually putting mental health back into primary care settings and even pediatric settings. There's a model that's actually not new. It's called the collaborative care model. It's been around for a while. There's over 100 peer-reviewed studies supporting its efficacy in early detection and care in primary care settings. But what has changed recently is that we actually have some billing codes in place that Medicare has approved, all private health plans have approved, and Medicaid has gotten through in 33 states. And so we are working on the ground in health systems throughout Texas and around the country to teach primary care practices and systems how to actually implement this model so that they can get paid for it. They can detect patients just like we get screened for our blood pressure and our heart rate. Um, Doctors in primary care settings can screen for depression and anxiety, and we can catch it early so that people can get access to care sooner than waiting that decade. And the technology advances that we're seeing are only going to accelerate our workforce's ability to be able to implement this model.
Yeah. Well, I'm glad you brought up Texas because obviously that's where I've spent the vast majority of my career. And everywhere I've been, the delivery of mental health care has been just, as I said earlier, abysmal. You know, case in point, in my last hospital, we had a mental health facility, and it was the only facility within about 40 miles of our city, and we had horrific funding challenges, and this was an ongoing battle since, its inception probably 30-ish years ago. Well, we've been working on reimbursement for well over 10, 12 years here, and finally, because we were hemorrhaging, a couple of million, 2 to $3 million a year, what are you seeing from particularly a Texas policy
Yeah.
initiative? Anything going on as far as, increasing access, increasing funding, or thinking anything along those lines? And I asked that with the background of growing up here in Texas and remembering the old state hospitals. We had lots of beds. We had our huge facility in Dallas that shut down over the last decade. Now, granted, care in the facilities had declined greatly. It needed to be modified, but shutting beds down was not the answer.
Right.
So, talk to me a little bit about y'all's work in that.
Well, I'm really delighted to tell you that part of why I came to work at Meadows 4 years ago was because I was actually observing from afar the investment that Texas was starting to make in its mental health programs. Um, and there is no state in the country that has invested more in mental health services than Texas over the past three legislative sessions. Um, One specific program that is a groundbreaking program that was started as a pilot in Texas. It's now been funded at scale throughout Texas that other states are starting to look to. Is a program called T-Chat, the Texas Child Health Care Telehealth Healthcare Program. I'm getting the acronym not completely right, but basically what it does is it provides an easy button in every school in Texas for someone who's working there who may notice that a child is struggling, that they can press and that child gets same day access to one of the academic medical centers, child and adolescent psychiatry programs for a comprehensive assessment and up to 6 sessions via telehealth. Um, we were really excited about getting that program to a place where it is now available in every county and every school in Texas as part of this priority that we have of early detection when we know that most mental illness begins in childhood and early adolescence. So that's like one really exciting opportunity that's been growing over the past few legislative sessions. I will say there has also been an investment in some of the brick and mortar healthcare needs that did go away. And so that we are already starting to see design of new inpatient psychiatric hospitals. We've been helping communities where those hospitals are going to be built really think about the design and how to create the setting so that it meets the needs of those specific communities. And one actually is in Dallas. And then the third program that I just want to highlight that was really a huge win this past legislative session is a new initiative called the Dementia Prevention Research Institute of Texas. Um, and Texas has invested, and it did have to go out for public vote last November. But Texas has invested $3 billion in this research institute over the next 10 years. Yes. And it's being designed and stood up similarly to CPRIT and how the Cancer Research Institute of Texas was designed, which has driven tons of innovation in cancer research and care, and ultimately patients who can now recover from those illnesses. We're very excited about the Dementia Prevention Research Institute because of not only the cognitive decline needs that we have when it comes to mental and brain health, but also because we know of early life depression is a risk factor for later life cognitive decline and dementia. And so having that prevention aspect as part of the funding really does open up a lot of opportunity for us to have transformative transformation in how we think about the brain, what we know about the brain, and what we're going to be able to
Mhm.
detect and treat at an earlier stage in life.
Well, for one, that's great to hear about the dementia prevention project. You know, as somebody who is getting on in years, that's something that I always am very concerned about. My father suffered from it, and saw the effects of that on him and on the rest of the family as well. Yeah, going back a little bit to your comment about the investment in bricks and mortar, and that's great to hear. But that was a huge issue for our facility here in Waco. And one of the reasons that we ultimately ended up having to close it down is because we saw so many patients coming through that we couldn't treat locally, but we didn't have a referral source that could get patients in a timely fashion. And so oftentimes we had, and unfortunately, they were primarily
Yeah.
adolescents. We would have adolescents boarded in our ED. I recall one being with us for 27
Ugh.
days, and because we could not find a facility that would accept him. And so, again, great to hear, but that's gotta be accelerated, and it can't be located just in the major metropolitan areas. It's got to be, taken out to, not small communities, but smaller, tertiary communities like a Waco, like a Tyler, Lubbock, and Midland, and places like that while they are a lot smaller than the DFWs, the Houstons, the Austins, San Antonios, they still are a locus for regional healthcare. So
Yeah.
Just my 2 cents.
No, I couldn't agree with you more. While we are very excited about the progress and the investments that are being made, we are digging out of, several decades of, challenges that, we've gotten ourselves in, and part of why we got ourselves into this is because we took mental health out of the rest of healthcare and treated it only as a specialty program. Whereas in most healthcare, there are people who can be treated in primary care settings, and then we can save the specialist for and those specialty beds for the people who actually need them. It's actually one of the things that I'm most excited about as far as the promise that we're seeing by leveraging our augmented intelligence AI related technologies is the ability that we're going to have to very quickly understand what how to match patient needs with the right level of care and with the right type of care provider. And I think that's going to go a long way in helping us optimize our existing workforce, extend it in a lot of ways with either other humans or other types of technology, digital solutions. And then, if we are successful but with both the early detection work that's happening and leveraging the technology to help us match care, I think we're actually gonna see in the not too distant future, um, better access, and not just better access, but better access to quality services.
Mhm. I'm glad you brought up AI because, my gosh, all the companies that I'm advising, yeah, they've got some form or fashion, they've got a toe in the water in AI, and I'm having to go and learn a great deal about it, and it's just fascinating and a little bit daunting. So where do you see AI realistically improving access or outcomes over the next 5 to 10 years?
Yeah, so and it is daunting, Kevin, like, I wanna, like, just
Mhm.
acknowledge that. It's daunting for everyone, and some of the reasons that it's daunting is that it's moving very fast, and every day that you think you've got your head around it, like, something's changing. The second reason
Mhm.
is, we have a real literacy challenge. We are using the word AI as if it's one thing, when we know there are lots of different technologies that fall under the AI
Mhm.
umbrella or the agentic AI umbrella. And we don't have a lot of understanding across our population about what we're actually saying and what we're meaning when we're talking about it. So one of the
So
things the Meadows Institute is doing right now that I can't wait to get out the door, we're just working as aggressively as we can, is we're actually creating a series of literacy tools. Um, and explainers of how AI can help to solve some of the challenges that we have in mental health care. And so we have a series of use cases, positive use cases that we're getting ready to release that walk through if we have a problem like triage in mental
um,
health care, how can AI be applied to support making sure that patient, that customer, gets matched to the right care at the right time? And how do we make sure our clinicians know how to use this technology and feel confident and trust it so that they can integrate it into their care model? We're going to be releasing these and working with our leaders on Capitol Hill and in Austin, mostly because they have asked us to help them. There's a strong interest in Washington right now to try to update our health tech infrastructure
yep.
overall in the country. And there's a lot of momentum behind how AI can help us update our overall healthcare infrastructure. And the Meadows Institute is working very hard to make sure mental health is a part of that conversation, and we're not treated separately or with extra
Mhm.
protections like we were in the past when other health tech investments were made in the healthcare infrastructure overall.
So you certainly operate at the intersection of public systems and private capital and entrepreneurs and large healthcare organizations. So if you could fix one structural barrier in our mental health system tomorrow, what would you change and why?
If I could wave my magic wand, I would want every uh, pediatrician to know how to effectively screen for mental health services and to have the time and the capacity and the tools to be able to address a problem with one of their patients if they screen positive.
Yeah. Yeah. Yeah, I think you're exactly right. Yeah, and my physician friends are always talking about the lack of time with patients, and it's getting worse and worse. Because of pressures from either being employed by a health system or pressures from payer sources, and they just don't have the time with patients. Hits the real increase in concierge medicine. And my gosh, that could be multiple episodes of the pod, but I won't drag you into that morass. So
I'll just
yeah,
respond
go ahead.
again. I think that so this is another use case that we're going to highlight in our
Mhm.
explainers. All the doctors I know, all the nurses I know, all the clinicians generally that I know want to care for people. They do not want to spend time figuring out billing, figuring out all the paperwork. And I want them to care for more people, right? That's why they went into the field, and that I want them to operate at the highest and best use of their license. And so we're already seeing, and I'm encouraged at some of the data that's coming out about how this is helping our clinical workforce with the time management that they need. By leveraging, some of the AI scribes, some of the AI tools that are helping with billing and referrals and scheduling, it's significantly positioning our clinical workforce already to be able to care for more people.
Yeah, yeah, that's great to hear. Well, I don't wanna gloss over the startup and the entrepreneurs, that are involved in mental health. So, you've had a lot of great experience, in the past before coming to the Meadows Institute. So what did that teach you about scaling mental health innovation that most startups just completely underestimate?
Well, one of the things I always try to get early stage founders to think about is who's actually going to use what they're designing and why should that customer care about it? What pain point are they solving for that end user? It's amazing how many times they don't think about the actual end user and the pain point. And then the second thing really is like, all right, if that person cares, who's going to pay for it? And, if you don't think about how you label or describe your innovation early in, pre-seed series A, then you're getting off on the wrong foot. And you really need to be thinking about some of these critical issues about 2 years before when most entrepreneurs are thinking about it.
Okay, my last question for the healthcare executives who are listening today. What's one concrete move they can make in the next 12 months to meaningfully improve mental health access or integration in their community?
Invest in integrated behavioral health programs across all of their healthcare programs. Um, it is an investment because those clinical services have to change their operations. They have to learn a new protocol to integrate mental health into the clinical setting. But at the end of the day, it's going to save them money if they do that investment early on. And we're seeing those numbers from a financial perspective, from a outcomes perspective, but they're not happening fast enough. And I want every executive to be thinking about not just doing mental health programs because it's the right thing to do, but doing them because it's the right thing for their bottom line also.
Yeah, in today's healthcare environment, and you know this, the funding pressures for all healthcare executives are just massive, and so it's really sad that we see the needs in our communities, but we have to prioritize those based upon what, frankly, helps us keep the doors open. Because you look at it from a standpoint that it's better to have the hospital open and viable and maybe providing limited services than being, trying to be all things to all people and not be able to survive.
Yeah. Kevin, I think I would just offer my team would not be happy with me if I didn't offer. One of the things that the Institute has done a lot in both community health systems, academic health systems, private sector health systems is to come in and do an assessment and really look for not just where they should be, where they have opportunities for addressing mental health clinically, operationally, but to look for where they're leaving money on the table related to reimbursement of those mental health services and to help executives make some of those decisions so that it's not just better care, but it's better care that is financially sustainable.
Mhm. Well, that's great to know. My audience really, I'm sure that certainly piqued their interest. So, Kacie, I've really enjoyed having you on. Any final thoughts for my audience today?
Well, please check out the Meadows Institute. If you have not worked with us in the past, know that we love working with all kinds of different programs, all kinds of different organizations, and we would welcome an opportunity to work with your listeners to help them reach their goals and help us have better, innovative mental health services across the country.
Fantastic. What's the website?
So the organization is Meadows Mental Health Policy Institute, and it is mmhpi.org.
Great. Thanks for making that easy. Uh, Kacie, it's been a real pleasure having you on. I don't care today. Thanks so much for being with
Thank
me.
you for inviting me, Kevin, and it was such a delight to meet you at the Pegasus Park holiday party and to spend time with you today.
Oh, well, thanks so much. Kacie Kelly, Chief Innovation Officer of the Meadows Mental Health Policy Institute. Really appreciate you being on it. I don't care today. And thank you, audience, for joining me on yet another episode of I Don't Care with me, Dr. Kevin Stevenson. And we'll see you next time. Thanks.